Okay, everybody, we have a special guest here, not only an orthopedic surgeon, but also my father, Dr. Chip Abrahamson. Recently got COVID and recovered. Figured this would be a good opportunity to just talk about what it's like getting one of the variants, because that's what we think you had. You live in Florida. Delta, at least, is pretty common down there. So tell us what it was like.
I suspected I was going to get it because my wife came down with it first. I woke up at 3 o'clock in the morning after going to sleep feeling fine, and I could tell that I had a flu. Weakness, it didn't feel right. And I got up in the middle of the night and decided I had COVID. I didn't have a sneeze. I didn't have a cough. I didn't have even a runny nose. Just felt very weak. My wife was tested after getting symptoms a few days before I came down with it. She tested positive after having symptoms for 2 or 3 days. I started to lose my sense of smell maybe a week later. And then by about 9 days after being exposed to her, when she got back from an airplane trip, that's when I came down with it.
What do you think people should do if they start feeling symptoms?
Everyone should have a game plan. You should have a game plan for where am I going to go if I come down with this? Am I going to go to an urgent care? Am I young and healthy and I'm just going to live through it? And I'm not going to go to a doctor, or I have a family doctor that's willing to treat me appropriately, or there are online doctors who will treat if you're unable to find a doctor to treat you locally through telemedicine. And the first thing you do is you get a test if you think you're sick, and you can get a kit and test yourself, an antigen kit. You can go to an urgent care and get this same rapid test. And that's usually what people do because a PCR test takes, I believe, 48 hours. So I went to the urgent care and got the rapid test, and it was positive. It's very possible when you get the rapid test for it to be a false positive. So there are specific instructions if you do it at home, or even if someone does it for you. If you go to an urgent care and you have a rapid test and you sit there 45 minutes until they have the result, you should question them, because if the test was let sit more than 20 minutes, it could very well be a false positive. That's the most important thing I think to know about what do you do when you get sick. Have a game plan beforehand, know where you're going to go to get treated, and realize that this rapid test can be a false positive if somebody lets it cook too long. It's supposed to be read within 10 to 20 minutes. And so you can expect to go sit in the room, in the exam room, and stay in the exam room, and 10 minutes to 20 minutes later, no longer, you should have the result of your test. And if you go 30 minutes or more sitting there waiting, then question them and make them do it again if it's positive and they waited too long.
You're describing having a game plan. Why should people think about this ahead of time? Most people are like, well, isn't that what a doctor's supposed to do? Have a game plan. Why am I the person that needs to have the game plan?
That's a great question. And the reason that you should have a game plan is because most doctors will not treat. I know of someone who went in early, got a positive test, and they were not treated at all. They were told to go home and wait until they were sicker and then come back, just rest and take fluids. And they were given no options, including an option that our governor in our state of Florida has recommended and opened up many centers in our state. So you should have a game plan so that you know what the options are, so that when you go in, if you have a doctor who's afraid or is ignorant, or you get a physician assistant that doesn't know, or a low-level provider, and they just tell you to go home and rest, you should question that. And if you have a game plan, then you'll have someone knowledgeable and someone who is willing to treat beforehand even if it is someone online. We'll get into that more later. But that's the reason to have a game plan. You might not get a treatment that could potentially save your life just because you ended up with a provider that was ignorant or unwilling to treat because of all the pressures on doctors from their institutions to follow the party line.
I want to get to that part in a second, because I also question whether it's really just pressure from institutions and not just, you know, many doctors' own arrogance, I think, around this particular topic. But to go back to what you were discussing about, you know, being sent home until you're sicker, why not do that?
Part of your game plan, you should put yourself in a risk strategized category. If you're under 45, according to one good doctor who has a protocol online, and if you're healthy and you don't have diabetes, you're not obese, then you're such low risk for a problem that you can go through it. In fact, my first couple days, I was really wondering if I really needed to do anything specific to treat. Although I'm 67, I have no comorbidities. I take a good vitamin D supplement. I eat healthily. I get plenty of sunshine and exercise. I have no stress in my life. And so I'm at very low risk. So I could have considered no treatment at all. But the general recommendation is if you're over 45, your risk of getting the inflammatory response, the cytokine storm, pneumonia, low O2 sats due to microthrombi or blood clots in your lungs starts to rapidly increase. And so age is a big factor. So you should risk stratify yourself beforehand. And if you fall in the high risk category, over 45, or you have comorbidities, then you should definitely consider doing something the day you're exposed, if not the day you get sick. And I think we should I should just mention that when you are exposed, if you're in the high risk category due to your age or comorbidities, you should have a game plan for what am I going to do before I even get symptoms, because you can lessen your risk, I believe, from all I know, by doing something when you get exposed and not waiting until you get the symptoms.
What was your worst reaction to this? Your worst day as you were recovering from it, and yeah, just what was the hardest thing to deal with?
This hit me instantly, and my symptoms 3 days later were no worse than they were the day I got it. It's not like a cold. I didn't get a sore throat. I didn't have prodromal symptoms. Other than I could tell, I couldn't smell. I did mention that at dinner time, I couldn't smell it as well. It just things didn't taste as good. My appetite wasn't as good. So I did have some symptoms beforehand, but it was more lack of smell. Then suddenly 3 o'clock in the morning Saturday, I woke up and I was sick and difficulty walking, extreme weakness, no fever, no cough, no sneezing. A couple of days later, there was a little bit of a cough, but really the symptoms didn't change. For the 5 days that I had symptoms, and then suddenly 48 hours after my infusion, I felt fine. I was still weak. I still am today. I can't play soccer as hard or work outside as hard in the hot sun. But I'm close to back to normal. And I'm about 2 weeks out.
Again, we're going to get into the specifics of what you did in a full video on my other platforms. The links are in the description. Easy to find. We just cannot talk about them here on YouTube. But I wanted to go back to your point about doctors feeling pressure from institutions, because, you know, I have friends who are doctors and I read their tweets. I see how they're talking about this, and it doesn't seem like they're all being pressured. It seems like they feel like you're just crazy if you think there are these other options out there. I have a friend that when I, said, hey, that, you had gotten COVID and what you did, she was like, I'm not saying anything, I'm not going to even say anything about it. It's just, whatever, thinking you're just totally nuts. For the average person who's watching doctors have this kind of battle over options and this virus itself, and it's just nearly impossible to understand what's really going on. It's like you're just trying. I know people who are like getting stuff from Mexico because they can't talk to their doctors. They feel like they can't talk to their doctors. People who are practicing in Texas now have patients flying in from Washington because they know that, that doctor will be open to using a therapeutic earlier in treatment. It just seems like a crazy time to be both a patient and a doctor. And I'm just curious of your thoughts on why that is.
Well, I have 35 plus years experience as a doctor, and it didn't used to be like this. Doctors used to see the patient one-on-one. I can remember many times 45 minutes to an hour just listening and asking questions, going through their whole story. And that just doesn't happen anymore. Doctors now come in with a conceived notion about what the problem is. They have the test results in their hands. They often give the patient 2 to 3 minutes and tell them, well, here's what your test shows. They'll do a cursory physical exam. They won't ask many, if any, questions. And so things have really, really changed. So let's get into why have things changed? Where is the pressure or the incentive coming from for these doctors to not treat patients the way we used to? And that's why people are uncomfortable. That's why they're flying to Texas, say. They want a real doctor. And there's so many reasons. However, I think occasionally, if not often, doctors are lazy. It's much easier to have your protocol. This is what I do because this is what the academy does, or the whatever does, and they don't have to read journals. They can just go to orthodoc.com or whatever and read from a quote unquote expert and follow the protocol. And there are a lot of websites now, up to date, and ortho bullets that make it very easy to decide what to do with a patient without thinking, without looking at the primary sources. And so you have doctors now that are doing cookbook medicine. They take their cookbook out and they follow the recipe. And that's not doctoring. I can get a technician to do that. A doctor is supposed to listen to the patient, take a history, treat each patient individually, and find out what the patient's fears are. Anxiety is a big risk factor for this disease. And then reassure the patient by telling them that here are the options and let's decide together how you want to approach this. That type of medicine is very unusual. I would say in the younger doctors, certainly age 40 and below, cookbook is what you get. Doctors are pressured by their institution. They receive daily emails now. I work for the VA Medical Center in St. Petersburg at Bay Pines, and we receive daily emails telling us how to treat people. Now, they don't say, okay, here's how you're going to treat somebody, but they do say, here is the FDA recommendation for ivermectin. And, it's 6 months old, and it's very clear that what they're saying is, don't use that drug. You can edit out the name that I said, but they surreptitiously influence, and they will absolutely will bring you in and have you sit before a committee and defend yourself if you go against anything that they say in these emails. And you can sit there and try and defend yourself with the science all day long, and they'll just come back with their emotional response. This is what the CDC says. This is what the FDA says. Blah, 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 blah. And then, you find out, as some doctors do when they continue to question, that one of the biggest contributors to the hospital's foundation is some pharmaceutical agency that makes a vaccine. So there is conflict of interest in the institutions. They get their money from people that want them to do certain things, and they pass that down to the doctors. And it is much, much easier. I think it's lazy. I think it's irresponsible on the part of doctors, but it's a heck of a lot easier just to go, well, this is what they said on the email, so this is what I'm going to do. So I can just go home and watch my YouTube and, go to the gym and whatever. Doctors this day and age stand up for the patient far, far less. And if you can find a doctor who will stand up for you, regardless of the risk to his career or his reputation, then stick with him.
If you like this video, don't forget to check out exclusive content on my other platforms. The links are in the description, where there are also links for how you can support my work.